Hello, my name is Joe Bowman. I'm the chest pain stroke coordinator here at Johnston Health in Smithfield. I'm here today to talk to you about heart health. Okay, everyone, welcome to Cardiovascular Disease 101. Again, my name's Joe. Let's talk heart to heart. Quote I wanted to share: "It is health that is real wealth and not pieces of gold," by Mahatma Gandhi. That just states that your health should be more valuable to you than any riches you may come into. Today's topics in Cardiovascular 101 are going to be heart attack symptoms and stroke symptoms. We're going to discuss risk factors, what it feels like to have a heart attack or a stroke, what it looks like, and what potentially causes heart attacks and stroke. We'll then discuss what to do about a heart attack or stroke, discuss briefly some interesting facts about your blood pressure, go over some heart facts, briefly introduce your local medical team, and describe some things you can do after an event, along with where to go for treatment for either heart attack or stroke symptoms. We'll start with heart attack symptoms. Early signs of heart attack include, but aren't limited to, back pain, a feeling of chest pressure, squeezing or discomfort, excessive fatigue, feeling of fullness in the belly, pain in the jaw, nausea, pain that may be traveling down one or both arms, rapid shortness of breath, pain that spreads above the jawbone or into the lower body, and sharp knife-like chest pain when coughing or breathing. Women's heart attack symptoms may differ slightly in that they are usually less pronounced than men. When you understand how men and women experience heart attacks differently, you can be better prepared to identify and respond to symptoms. Women may feel a rapid onset of exhaustion, nausea with or without vomiting, pain or numbness on the right side of the body, stomach pain that feels like the flu, heartburn, or an ulcer, upper back pain that travels into the jaw or teeth, and chest pain or angina with burning, aching, or tightness in the chest. The risks of having a heart attack are many, and most can be modified or mitigated. You should talk to your doctor about ways to address these risk factors for heart disease. Tobacco use and vaping is a prime risk factor for a heart attack. Diabetes and other metabolic diseases, family history of cardiovascular disease, high blood pressure, lack of physical activity, obesity, preeclampsia in pregnancy, and use of hormonal birth controls, particularly while smoking or using tobacco. It is important to treat and attempt to avoid and/or control these modifiable risk factors. Consult your doctor as far as what you can do to reduce your risk. What it feels like. One of the most common descriptors of having a heart attack is an elephant sitting on my chest, a truck parked on my chest, heaviness with severe pressure in the chest, a sensation feeling like they're breathing through a straw, feels like you're unable to take a full, complete breath, or struggling to get air in to satisfy your body's need to breathe. For women, sometimes they've described it as feeling like a mammogram in the chest, squeezing, tight pressure in the upper chest. Flu is also a common symptom described by women experiencing a heart attack. Gears grinding in the chest, describing the feeling of tightness and pressure along with that shortness of breath. Heartburn from hell, just like it states, often comes on without having eaten anything that might normally cause a person to have heartburn or indigestion. Arms felt like bowling balls. That just describes the deep level of fatigue that people feel when their heart's not pumping optimally. What it looks like. This here is a picture of a critically blocked left anterior descending coronary artery of a patient having a heart attack. Blood flow downstream beyond that little divot of white there is greatly compromised. The left anterior descending is one of the three main arteries which supply blood flow to the heart. So the left anterior descending artery, as you can see, is one of the three main coronary arteries or arteries that pump blood to the muscle of the heart itself. The left main coronary artery here comes off the left cusp of the aorta, and it splits off into two branches. The circumflex branch, which covers the upper side and upper portion of the back of the heart. This left anterior descending artery here comes down the front wall of the heart and covers the more muscular left ventricle of the heart, which is responsible for pumping blood out to the entire body. The third coronary artery comes off the other side of the aorta. It's called the right coronary artery, and it covers the back and bottom side of the muscle of the heart. This depicts a badly diseased left main coronary artery and a critically blocked left anterior descending artery of a patient that was having a heart attack. This person required coronary artery bypass surgery or heart bypass to fix the heart's blood flow. Critical blockages such as these can't always be fixed with balloon angioplasty and or stent placement. Sometimes surgery is required in order to restore adequate blood flow to the heart muscle. It is called coronary artery bypass surgery. Highly skilled surgical team members harvest good veins from the patient's leg or legs and then re-implant them in the chest and use them to carry and deliver blood around these blockages in the major arteries of the heart. This can provide a greater quality of life for years to come following surgery for people with severe multi-vessel coronary disease. This picture depicts a 100% blocked left anterior descending coronary artery causing a heart attack. Clot or debris from plaque was sucked out from this woman's artery at Johnston Health's cardiac cath lab, clearing the blockage and restoring blood flow. Aspiration catheters are only one of many tools at Dr. Hook's disposal to open blocked heart arteries, treat heart attacks, and provide great benefit to people with coronary artery disease in our community. What causes it? This is a picture of microemboli, which are either clot and or dislodged intraarterial plaque. These were aspirated or sucked out of the coronary artery of a gentleman having a heart attack. This was performed at Johnston Health's cardiac cath lab. Removing these clots or plaque particles freed his blockage and allowed blood flow to return to his heart. Plaque formation is caused by smoking, tobacco use, abnormally and untreated high cholesterol, unhealthy diet, and unhealthy lifestyle choices. And the one thing none of us can hide from or change, genetics. Our family history often dictates that we carry certain markers that leave us susceptible to these sorts of events. Moving on to stroke. The symptoms of possible stroke include, but aren't limited to, severe sudden headache. Oftentimes people will claim it as the worst headache of my life or a thunderclap headache. Dizziness is a symptom of possible stroke. Balance problems, difficulty walking or standing. Speech difficulty, inability to get words out. Ability to get words out, but inappropriate or incorrect words are coming out. Or gibberish, just babbling noises. Vision problems, vision loss in one or both eyes can often indicate possible stroke. Floaters or blank spots in vision. Drooping at one corner of the mouth or facial asymmetry where one side of the face looks like it's hanging lower than another side. Weakness in arms and legs, or both, arms and legs, usually on just one side but can encompass both sides at the same time. Also, a loss of sensation, taste, or smell. Risk factors for stroke are the same as those for heart disease. What it feels like: a knife in the back of the skull, very sharp stabbing pain, the back of the head. Rainbow-like kaleidoscope, visual disturbances, floaters and spots, waves of light, shapes of various colors have been reported. Sometimes these shapes stay in one spot in the visual field, and sometimes they move around. Lights went off in the eyes. Super bright sensation all of a sudden out of nowhere. A great and rapid sensitivity to light, requiring sunglasses, requiring the eyes to be covered. What it looks like. This is an image that shows internal carotid artery stenosis, or narrowing. The carotid artery is on both sides of our neck and carries blood flow to the brain. A narrowing or a blockage here can cause or lead to a stroke due to plaque rupture from either this blockage or an embolus or a clot getting caught in that narrowed space in the artery. Intraarterial plaque is caused by the aforementioned risk factors and genetics. Clots can be caused by many different factors. A few to mention: atrial fibrillation, which is a fast and irregular heartbeat requiring treatment by a doctor, can cause clots to form in the heart that then migrate out to the lungs and the brain. Recent long trips by car or airplane without breaks for physical activity, where people are sedentary or stationary for long periods of time, and blood clots in the legs, and uncontrolled and poorly managed diabetes are also risk factors for clot formation that can then migrate to the brain, causing stroke. Carotid artery blockages, as seen here, can cause a stroke by themselves or result in clot or plaque being formed and then subsequently moving up into the brain. This image here shows a middle communicating artery in the brain that's occluded or blocked completely, just past the little arrow there. This is caused due to a plaque rupture from a blockage or tight spot, or an embolus or clot that got caught in the artery, thus preventing good blood flow. Clots and plaque can also migrate to multiple or many locations at the same time. This is a different form of stroke. This is depicting a right internal carotid artery aneurysm. This is often caused by uncontrolled or untreated high blood pressure. This can result in catastrophic disability and often death to the person experiencing it. Uncontrolled blood pressure can lead to higher velocities of blood flow through the arteries. Over time, this can weaken the walls of the arteries and put them at greater risk of rupture. So as you can see here, I've got a graphic depiction of what velocity in the blood vessels does. So we've got normal blood flow here. As you can see, a wide open blood vessel. As this vessel gets narrower, it has much smaller space to be able to pull the same amount of blood through. So in order to make that happen, the velocity or the force of the blood flow has to increase. Over time, what this does is this can create pressure against one wall or another of the artery, then ballooning that side of the artery out a little bit at a time until it reaches a point to where it can't take it anymore as far as this ballooning goes, and then it ruptures, creating what's called a ruptured aneurysm. Okay, and blood then leaves the blood vessel or becomes pocketed in the extra tissue along the wall of the artery. What causes it? Again, this is another picture of microemboli, clot and/or dislodged intraarterial plaque. These can be the cause of stroke when they become lodged in an artery in the brain, thus preventing other blood flow. What should I do? Respond quickly and call 911. Our local EMS providers are well trained to stabilize and improve condition before getting to the hospital. An ambulance may take you to one of Johnston Health's accredited chest pain centers for prompt, excellent care. Our local advanced life support trained providers are well equipped and trained to provide life-saving treatment before they get the person or persons to the emergency department. These fine professionals' skills are often the difference between life and death. Respond quickly. If someone collapses after showing signs of a heart attack, start hands-only cardiopulmonary resuscitation to increase their likelihood of survival. If unfamiliar with hands-only cardiopulmonary resuscitation, call 911. Our 911 emergency communication dispatchers are well-versed in talking untrained people through the steps. Mouth-to-mouth rescue breathing has been removed from this process, thus limiting bystanders' exposure to potential harm. You've just got to be willing to help. 7 tips to having a healthy heart. Stop smoking, vaping, and using tobacco. Eat a healthier diet. Be active. Lose weight if able. Manage blood pressure. Control cholesterol. And manage diabetes and other metabolic disorders. What about stroke? Stroke is an emergency. The faster we respond, the better the outcome for the person. Use these American Heart Association guidelines for recognition. Balance. Any kind of balance changes, sudden change in balance or coordination. Eyes. Vision changes. Double vision. Eyeballs doing funny things. Face. Facial droop if the face looks uneven. Arms. Weakness or numbness in the arm or arms. Speech. Slurred speech, difficulty speaking, or the person no longer can speak clearly. Time to call 911. Don't stall, call. Make note of the time the symptoms appeared and call 911 immediately. Make sure to remember the last time you saw this person well or without symptoms and report that time to the EMS crew when they arrive. Time of symptom onset helps guide what treatments may be available to help improve the person's condition. What is blood pressure and why should it be important to me? Blood pressure is the pressure of blood pushing against the walls of the arteries. Arteries carry oxygenated blood from our heart to the rest of our body, organs, muscles, skin. The higher a person's blood pressure is, the harder the heart has to work with each beat to keep pumping blood throughout your body. The higher your blood pressure, the greater risk you have for developing serious problems such as heart disease, heart attack, vision loss, kidney disease or failure, sexual dysfunction, and stroke. Keeping an eye on your blood pressure and ensuring that it is controlled is the easiest way to make sure you're keeping your risk low for developing severe or catastrophic complications. Vision loss can result in expensive surgery, uncomfortable injections in the eyes, and can be permanent. Kidney disease can become so severe that it can result in the need for dialysis, which can greatly impact someone's quality of life. What can happen? Stroke, vision loss, heart failure, heart attack, sexual dysfunction, kidney disease or failure. Vision loss associated with narrowing or high pressure in the arteries of the eyes. Heart failure due to the increased workload of the heart trying to fight against the blood pressure in the rest of the body in order to deliver adequate blood flow. And sexual dysfunction caused due to the high blood pressure preventing the arteries in that area to fully dilate. Blood pressure. What do these numbers mean to me? Systolic blood pressure, which is the number on top, the first number, indicates how much pressure your blood is exerting against the artery walls when your heart beats. Diastolic blood pressure, the second number or the bottom number, indicates how much pressure your blood is exerting against the artery walls while the heart is resting between beats. As you can see the scale here, your normal blood pressure category, you want your systolic number to be less than 120 and your diastolic to be less than 80. For a diagnosis of elevated blood pressure, typically encapsulates a reading of 120 to 129 in the systolic or upper number, and then less than 80 in the bottom or diastolic number. High blood pressure is denoted as anything with 140 or higher in the systolic or upper number and 90 or higher in the diastolic or lower number. A person in hypertensive crisis is diagnosed when their systolic blood pressure or upper number is higher than 180 and or your diastolic or lower number is higher than 120. The higher the numbers, the higher the pressure, and the harder your heart has to work to deliver blood to the rest of the body. Please seek expert guidance and assistance with management of your blood pressure if it is elevated. It may not prevent everything that could possibly happen, but it can lessen the severity of many different illnesses. For instance, more severe disease complications have been seen in patients with COVID-19 as a result of uncontrolled or untreated high blood pressure. I'm going to share some facts with you about heart disease based upon 2019 numbers. 23% of people in the country die of heart disease. Roughly 1 in 4 deaths nationwide is caused by heart disease. It is the leading cause of death in Johnston County, North Carolina, and in the United States of America. It is a cause of 1 in 4 deaths in women. That's 1 per minute, and it's 80% preventable through risk factor reduction. 116.4 million people, or 46% of U.S. adults, are estimated to suffer from hypertension. 1 in 5 American adults reported achieving adequate leisure time, aerobic and muscle strengthening activities to meet the physical activity guidelines as put forth by the American Heart Association. 1 in 6 males and 1 in 7 females in the United States are current smokers or tobacco users. By 2035, more than 130 million adults, or 45.1% of the U.S. population, are projected to have some form of cardiovascular disease. Total costs of cardiovascular diseases are expected to reach $1.1 trillion by 2035, with direct medical costs projected to reach roughly $750 billion and indirect costs estimated to reach almost $370 billion. This slide here depicts who you may see locally, as these are cardiologists that practice here at Johnston Health. What can you do after an event such as heart attack or stroke? Here at Johnston Health, we offer cardiopulmonary rehabilitation in a monitored setting right across the street from the hospital, making it very convenient to our local community. What is cardiopulmonary rehabilitation? Cardiopulmonary rehab is a medically supervised exercise program which is tailored to meet each client's individual needs. What makes up cardiopulmonary rehabilitation? Exercise, stress management, education and short classes on risk factors, risk factor reduction strategies, medications, disease management strategies, exercise safety, and benefits of exercise. This is guided by a diverse team of medical professionals, including a medical doctor, registered nurses, respiratory therapists, dietitians, and exercise and sports science specialists. Some benefits of cardiopulmonary rehabilitation include it can improve your quality of life following a cardiovascular event, improve your blood pressure, cholesterol, and also help to control blood sugar, increases endurance, strength, and mobility, can help reduce the risk of recurrent events. Cardiopulmonary rehabilitation helps build confidence to return to normal activities and work safely, and it can provide patients with knowledge to help maintain a healthy lifestyle following an event. Where to go? You can go to either of our hospitals, both of which are American College of Cardiology accredited chest pain centers. And then, as stated, the Johnston Health Cardiopulmonary Rehabilitation Facility is directly across the street from the hospital in Smithfield. Every February, we at Johnston Health celebrate National American Heart Month. Thank you for joining us in support of this important initiative. Be heart healthy.